This tutorial video will show you how to create a long-term care plan and medication consent form. On Medical Tracker, we use a long-term care plan for an ongoing condition like asthma or a nut allergy. If the medication is going to be administered for less than 4 weeks, a short-term care plan should be created instead. After we have filled in the details within the care plan module, a care plan and consent form will be automatically created. Both the care plan and consent form can then be printed and signed by the parent or carer to authorise the care plan and give permission to the school to administer the medication. Once logged in, you will need to select the care plan tab. You will now be able to see a list of all the care plans that you have created. To create a new care plan, select the Create New Care Plan button in the top right hand side of the module. In the drop down, select Long Term and then enter the child's name. We can now add the condition by selecting Add Condition. You will need to select the name of the condition the child suffers from. If the child suffers from more than one condition, we can add another condition after. You will also have to select if this is an ongoing condition. You will now have to fill in the rest of the boxes, which are the medication name, the dosage of the medication, the times the medication needs to be taken, if applicable, the date the medication was dispensed by the doctor, the expiry date for the medication, whether the medication will be self-administered, and any special precautions. The child might need to take the medication before or after food. If you enter the times that the student needs to take their medication, you will have the option of creating medication use reminders, which will be sent to the contact you have selected in your school profile for the times entered. You can also create a reminder so you are notified 2 weeks before the medication will expire. When you are sent the reminder, you can click the link and a notification will be created to be printed or emailed to the parent. The medication expiry will automatically be imported into our medication expiry module. For this care plan, we are going to choose the 15th of June 2016 as the medication expiry date. Once you have entered the necessary information, you can press Save. You can always come back and edit this if you need to. If the student has more than one condition, you can select the Add Condition button and enter the information for the second condition. We also have 6 additional boxes that we need to complete for the long-term care plan. They are the student condition and individual symptoms, the daily care requirements, the procedures to take in an emergency, follow-up care, who is responsible, and GP details. We have entered some text into these boxes which can be edited. We would suggest consulting the parent or carer and your school nurse when entering this information. Once you've entered all the information, you need to press Save. A long-term care plan has now been created. You now have the option to print the care plan by selecting the Print Care Plan button. This will create a PDF document. When we create the PDF, we will automatically pull in the child's and parent or carer's basic contact details. We also pull in the information you've entered for the long-term care plan. All the information in our long-term care plan was created according to the guidance issued by the Department for Education. Here you can see that the first 2 pages of the PDF are the student's long-term care plan. At the bottom of the second page, the parent can authorise the care plan. We suggest advising the parent or carer to show their child's nurse the care plan before authorising it. The third page of the PDF is the consent form for the school to administer the medication. It is important that the parent authorises both the care plan and medication consent form. You can save or print the care plan using the buttons in the bottom right hand corner of this PDF. If you selected for the medication expiry to be tracked, it will automatically be created in our medication expiry module. Here you can see that the expiry date is the 15th of June 2015. You can notify the parents at any time by selecting the Notify Parent or Carer button, although we will notify you automatically 2 weeks before the expiry date. The medication expiry template can be edited in our admin module. For further assistance with creating or editing care plans or with any aspect of Medical Tracker, please do not hesitate to contact us on 0203 743 9599.